This is to my puppet servants and my sister Sharon. I am fine. As you can see, I'm in bed, night dress on, and resting my head. And a bloody head injury, and my mate's still got to take that thing off. Been in hospital. This thing on my arm. Okay, yeah, just keep it hold for me. Sharon's got the wrong end of the stick. What she's done in the texts, I don't know how many texts are around now because I'm still groggy. The side effects of the doctor in the hospital said the head injury is take a few days to feel myself. Bloody nightmare this is. If I was able to, I was sleeping up until literally 10 minutes ago. You don't get no sleep in the hospital. So I'm fine. My sister, she's always exaggerated since she was young. She means well, but she is. All she's done, she's gone and done this today, my sister, like shited up the wall now. Right, what she's gone and done, she's misinformed. I won't say lie, but I've got the evidence on my phone. Okay, so I don't know for rebuttal. My mate's just spent half an hour doing an email to my area. Okay, we're going to state who they are. I'm fed up of doing this. Northamptonshire County Council Public Servants, the Department of Short-Term Development Team South. Please don't worry, you employees. You can see, hear me now talking, resting in my bed safely, publicly saying that I'm okay. It is my sister, so-called next to king, that's misinformed you to an individual known as Voiceability Care Advocate. I won't say the lady's name. And she, instead of calling me, and I'm in the discharge ward, they call it when you leave the main hospital, you're in a discharge area being cared for to get the transport home. And my sister was saying, well, why can't you get an emergency respite? Or why couldn't you go somewhere in the Texas or got all the evidence? And my phone's about to die on battery because in hospital you ain't got a charge, okay? And I had a bang on my head Monday night, a freak accident. Nothing, no one's done nothing to me, nor me to me. It's just an accident. Anyway, by Tuesday morning this week, couldn't wake up, very poorly. So I'm calling by the evening. Well, I was in bed all day, couldn't keep awake, so I'm really like concussion. It's concussion. So anyway, my mates are caring for me, keep me fed, and eat what I can, and they're doing the best they can. Okay. So by Wednesday, it's not got better, and they say to call it your GP to just get checked out. Right, just precaution. So if I was a risk to myself or anybody to me, don't you think I would have contacted somebody myself? Oh. No, I'm not. Anyway, so that GP female, my own doctor in my area, says to call the out of hours in UK, it's 11 NHS 111 number, right? Google what concussion is, right, online, which my mates have done. So the lady on the phone says, we need to send an East Midlands ambulance service out to you, right? It takes, hold on, 40 minutes or something. Well, my private, don't need to say this, but I'm fed up with the bloody assumptions being made. My private friends, right, who do their honestly best, are really great. While I'm going through this complicated, it doesn't help when you have an accident, I know. Going through this UK for thousands of people, perhaps like me, United Kingdom, it's known as Care Act 2014. It's very in-depth, very complicated, and there's loads of questions, and it's a struggle trying to get out this bloody door in my wheelchair when I feel crap, like 4 days out of 7 in bed anyway. This is my deterioration of my health generally. That's why they have to go through the long, detailed process to get the right package of care the right funding because of cutbacks everywhere, and what eventually in the long term I can move somewhere that's got care and housing all combined. You don't rush it, because then you end up in somewhere middle of nowhere in United Kingdom, the people with high complex needs like I, where you got nowhere near nothing. And I've been like that years ago, so I ain't going to do it again. And I did not consent to my sister to make assumption and a presumption up and make something out of a text that's not even said to this female that claimed to have called her, and she never has before. This care advocate has not ever called my sister up before. Well, if somebody has, it's a social worker in the process of the Care Act assessment. They call up your friends or family to get information about the individual, to build up a profile of what your needs are like. And then at the end of it all, you're meant to get like a care plan, and then it goes off the council to do like work out a budget funding package, and then the individual gets a choice of self-direct funding or you choose your own care company. And then on top of all this, it's complex because the housing disrepair. You go back on this channel and you see the videos about the housing nightmare where they're not repairing. That's what's all caused my ill health. Well, the freak accident Monday, banging that blinking cupboard door up here, and that's what's caused no mark, yeah, just really nice horrible lump up here. And so obviously the doctors today in the hospital saying just need a bed rest for a few weeks. Anyone had a concussion? Well, you know what I mean. But when you're physically, unfortunately, complex disabilities already, then unfortunately, due respect to my sister, she's got her own personal problems and she's not thinking herself right. And I think she's overwhelmed because when I can't get a linking through to certain public servants, and when I'm not well, for an email, so certain things my personal friends can't do, the extra phone calls, letters, emails and stuff. And when they do get time, it's usually late at night. And it's not ideal, and that's have to be done to get the right care. So what she's gone and bloody done, don't know the ins and outs because she ain't admitting to nothing on a text. I just text her to get it out of her, to find out what the heck is going on, what's the facts, okay? Being polite, trying to bite my tongue here. And, you know, because at the end of the day, I know the ins and outs, what goes on. I was bloody hell, I live it 24 hours a day. People across the road and build a big building across the road. It's going everywhere. Anyone in my situation, you know what's going on, because you have to go through the due process. Now, in the hospital in A&E, right, they've changed it all in there. So I'm in one, they don't tell you nothing, these people, they're so busy, right? So I'm in one part of this ward, and don't forget, I'm literally really dopey and sleepy because of the concussion. So I'm in this place getting all these first blood tests. I don't know why they didn't do a scan. I don't know, concussion shows up or whatever, I don't know, but they didn't do that. So all they did was test your observations and observe you. That's what they can do, right? In A&E. So I don't know how many hours I was there. It's a long time. And uncomfortable blinking the bed. And they don't have any aids, disability aids. So yeah, it's a nightmare. Anyway, they went well. I was too tired. I was sleeping and I can't remember all the times. But just put it this way, it's a long time. Then one doctor comes very quickly. It wasn't there long actually in my room, about 10 minutes, and saying your blood's all come back fine. And then you don't mention nothing about any other offer services. You don't mention that you need what it's my area called integrated care. So it's run by Northamptonshire NHS Foundation Trust. And if I was like unwell, like, you know, what my sister's making out, I wouldn't be able to talk like this, would I? Anyway, so that intermediate care is meant to work temporary people that come out of hospital that might be at the risk of falling. And excuse me, someone's coming up with another thing. Yeah, so when eventually, cut long story short, I said, well, hold on, I don't need all this why do you say I need all this OT assessments and all this stuff? Because I'm going through all that already. I'm already being referred in the community, they call it community, and it takes weeks. It's not my fault there's a delay waiting list. And then I'm already going through the care system assessments and all that, and everything combined. It's complex. So you're talking to so many different bloody nurses. It's unreal. I wish there's just one you can say things to, and that just gets on your records, and then don't ask me again, kind of thing. It just don't work like that in the hospitals still. Anyway, so I was meant to move somewhere on the A&E, another part in A&E. I think they've just carved up the building, or I don't know what's going on. I didn't see it all. And I said, what? Where am I going? You know, they need your consent to do things. So, of course, I said, I question things. So I said, well, no, I don't need that if I really having all this and this, that, and the other, I explained. So they were content with the fact that I got personal cares, you know, friends coming in, unpaid, informal. In the statute law, it's classed as informal. So it's your business. As long as it's safe, you know, you're not getting armed, nobody arms you. So statute law, what they do, if anyone raises concern, is adult safeguarding. Look at statute law if anyone cares to, or watch videos, Care Act 2014, Section 42. If you're deemed a vulnerable adult, then anybody can raise a concern. And what my sister's gone and done under the table is gone and used this care advocate that I was building trust up with, a young woman, and now that's broken the trust for what she's gone and done. She's meant to be my care advocate to help me with this care assessment thing. And unfortunately, what she's gone and done is she's, but I don't know why she didn't come to me, because I've got my phone in my hospital, you know, it's not very charged because it's not good at charging in hospital, but still could have contacted me and asked me directly how I am. No. What she does, allegedly, goes and my sister claims this. My sister claims that this care advocate calls my sister in Wales to see how I am in the same town as this care advocate works. It don't sound right. So my texts back to my sister, quite a few of them were, what on earth is this care advocate contacting you? And then I'm saying about I waited 5 hours to get own transport, and I'm in a safe place. You know, they give you your food and do the best you can in the discharge department of the hospital, my area, NHS funded. They mean well. So the non-emergency transport is the ones that get you home on the stretcher, and that was a job. They eventually got me home. Not one text did I say anything that my friends are not caring for me. Not one text did I say they are pulling out today. Not one text while I was in hospital for the period of time did I say they are pulling out at all. Okay, this is my full rebuttal video to you public servants that might be concerned, or those of my family members might be watching this channel, that you get the facts correct. Okay, so I read between the lines. I've got the evidence of texts. No disrespect to my sister. She means well deep down. She just likes to exaggerate, and she's trying to push the system quicker. I appreciate her experience and training in South UK, in Wales obviously, but they will not push the boat quicker. You have to have the key right assessments first. And even if you do get offered a temporary respite, there has to be, like this advocate and the social worker said before, and a meeting a 31st of Friday when I wasn't ill like this. I was ill, but not as bad like this, with a head injury. And that was a Friday in the afternoon. A noisy bloody pub. I couldn't cope with all that. It's too noisy. They should have kept to the location, the cafe where we were. Anyway, it was said there that my friends are holding on until there is a lawful offer of choice and the proper outcomes in statute law of the Care Act, known as 2014. And it's also combined with health, social care and housing. Okay, So there's a plan already there. They just have to get everything done. It's very complicated, and it doesn't help I have an accident in the meantime. Okay. It doesn't need to trigger. My sister thinks it will trigger. That's her text wording. Like you need to be somewhere safe to recover. She said it this way in a text. So you can get some rest. Yeah, I can see that. She led me to believe it's a respite. So you can get urgent respite in emergency because you really do need a rest. And I agree, I do. I do need to be somewhere that is safe by choice and that I cannot, say my head injury recover. And then perhaps they can offer me proper, what they call it, OT assessments. I already said this ages ago, months ago in emails before my accident, and yet I've been refused. I said this last year to housing company employees. Find me a safe, accessible hotel that meets my needs. You pay for it, and I could have got my home repaired, and yet they blocked all that. So it's not me, okay? My sister knows all that. She's been copied as my next of kin before my mum died, and everything like that. So evidence is already emailed, paperwork, kind of paper trail. It's already there, black and white, and so is the social worker people. They call it care management, and there's a computer system they use. They all show your data. I mean, they all know this. They can even your medical data shared with the one care computer system. I can't remember the title of it. And also the ambulance servers are all link up, and it's just data, digital data. They can check everything. So I've got nothing to lie about. And it's just unreal that she's made this up. So whatever she said extra, not on a text, but to this female, that's triggered off that female to create a serious, unfortunate, made up, bloody shocked. No consent, by the way. She's not contacted me, this co-advocate. She's gone and done adult safeguarding on an emergency basis and also a welfare check. Yeah, on me. What? And this individual, I don't know, a lady, tried to call 4:30 when I'm half asleep. And then, of course, I can't respond to a bloody email by a social worker when I'm to rest and just when they got me in at 2:00. I'm literally sleeping because I had no sleep and with a head injury. So this is a video to fully rebut all your blinking made-up comments. All due respect, exaggerated. It's exaggerated, my sister's done, and it's caused this to this care advocate. So this care advocate thinks she's genuine, doing what she needs to do in a duty of care as a job role, but she hasn't got the facts, and she didn't come to me before she made the referral. So she's got aches on her face. It's all completely ridiculous. So the email's gone off 6:30 tonight. Two co-copied my sister in it. We fully rebutted, and my mates copied the texts and who said and the dates. Well, not dates, but mainly dates, but mainly the times, because I did not say yes. Did not say I didn't consent to any welfare check or adult safeguard. So there's no ground. There's no lawful ground. You're wasting the public purse, time, energy. Now, if there is a proper say, would you like a week or 2 weeks in this place, different where I was before, then they can help me with the luggage and I know where it is, and they will come up and say, well, we can fund this and this is where it is, and then it's properly done, not blinking, rushed at this like an emergency. That's panicking everybody. My sister, she's only caused panic in the social workers and the duty of care. That's what obviously will panic. So whatever she's gone and said again, extra, I don't know about, she's going to make me look bloody stupid, isn't she? And she's only going to waste the public purse time. I know she means well, but she should have not done it that way. You cannot, nobody can push it that way. If a hospital staff had a concern and they needed me to get all these OTs assessments or what they need to do people in a similar position to I, they would have made sure I didn't leave the hospital. Okay, and they would have made sure that we really do need to have these tests. And this is like they can arrange while you're in hospital, liaise with people in hospital, outside in the community with social workers and intermediate care team and the steps team and this Olympus care team and everybody else that need to help the individual. And it's known as rehabilitation, okay? So that's what can be done from hospital. So it is my sister that's added non-factor information that's caused this. So please back off and just please, work with me. Do not exaggerate. You mean well, but you've caused people getting, really, really got them really concerned. Okay? It's just going to take me a while for my head injury to get better, and my friends are doing the best they can. And you don't get it, Sharon, right? Okay, all due respect, you don't get it, right? But when it's informal care, you're a very intelligent woman. When there's informal care and your lawful right, look at what the statute law means. When they should assess you, or anyone, they assess you as you don't have care, but you do, right? So you could be your friend, it could be a family member, it could be somebody that you trust, right? Not, and these are not paid for. So they do their best. And unfortunately, the problem is, when I get ill like this, they struggle, right? And they only text my sister out of courtesy using my number to let her know that I had a head injury because she's my next of kin. So because of that, if it's not my fault my older son and daughter don't want to talk to me, that's fine. But don't exaggerate, because then it's causing this. So you need to make sure, I don't even see this, but she needs to make sure and goes back and say, well, she does need this, I agree. And I got it wrong. She has got a personal friends. My sister's not here to see anything. Yeah? So she hasn't got first-hand knowledge. So I have met and in the meetings and stuff before when I've been in hospital. So if people were concerned about me, the staff in the hospital, they could easily done things there. I was waiting for 5 hours of transport to come home. Yeah? And then I get this when I get home. Oh, come on, I need to rest now, get some sleep. But this is my poor rebuttal, right? Family members mean well, but when they exaggerate, because they might get concerned that they're all the way down there and I'm up here. If my other family members cared, they're in my area, they would have been to phone me and see if I was all right, if anything they could do for me, but they don't. And that's my bloody family members for you, because they might be going through their own problems, and the grieving of the death of my mum. So, just don't make it difficult. Just do things carefully and with my consent. And by the way, what's happened isn't with my consent, and nobody consulted with me. And this is how my sister has used that co-advocate. No. You don't do that. You come to me as your next of kin. I'm your precious blood sister, for God's sake. You don't do this to your own family member. But remember, you mean well. I've got nothing against you, but you need to do it properly and carefully. I'll be all right. I just need to rest. Thank you for watching. This is pointing at these fake people. Do not just check your facts before you go and do referrals. And I know you don't always have the consent of the individual by certain words in statute law, but you haven't got the facts. I've got the evidence on my phone, okay? And the email's already gone out, as I'm doing. Gotta go. Take care. God bless you. Keep safe. I'll be all right. Just need time to feel better.